Ask the Expert, brought to you by Common Spirit Health.
We are asking the experts with Common Spirit Health. I am here with Dr. Ryan Callahan. Thank you so much for sitting down with me.
Thank you.
Now, we are talking about our feet and our ankles, and they support our entire body, but they are often overlooked. What common injuries or issues or pain do you see with them?
I'll take a little bit of a controversial stance on this.
Okay.
There are some things about your feet that you should ignore.
Okay.
Sometimes people get really fixated on a bunion or a hammer toe or something in their feet that is really inconsequential.
Our stair toes or weird toes
Yes.
or something.
Yeah, it looks funny. If it doesn't hurt, don't worry about it.
Okay.
But that's the thing that I would say is a lot of people do live with pain, whether that's arthritic pain. Sometimes people have had ankle sprains that just won't go away. They keep rolling their ankle, that something just doesn't feel right. Those are the type of things that I say, hey, if your pain, your function is being affected, come and see us and see what we can do for you.
Okay, would that fall into the red flag category that suggests that they need to see a specialist? What would we be looking for?
100%. If you're in that situation, I can't walk anymore.
Ugh.
If you're seeing a decreased activity level, your pain levels are going up on a daily basis, you're just not doing the things that you want to do. And then going back to the things that maybe you should ignore, if those things are getting worse, the deformities are changing, the shape of your foot, just the way that you're doing things is changing, of course, let us take a look at it and make sure it's not a bigger problem.
Now, does footwear play a big role in these things?
It can. I don't want to overstate that too much just because some people get so fixated on what is the right shoe. The problem is we don't know what the right shoe is unless we know what the problem is. And so a lot of times we will need to diagnose a problem, the shape, the deformity, whatever pathology is in your foot is really going to dictate what shoes you need. So yes, the shoe wear can be very important, but it's hard for us to say this is the right shoe. There's the right shoe for everyone, but it's just not.
But not knowing the issue.
Exactly.
Sure. Now, if someone's told they need more advanced treatment, what kind of surgical options are out there today?
There are a lot. Sure, a lot of people have heard of different treatment options. There are things that people just don't know about either.
Yeah.
Ankle replacement is one that everyone's heard of knee replacements, hip replacements, but a lot of people don't know that you can have your ankle replaced as well.
You don't hear that very often.
Right. Techniques have changed, implants have changed, and so there's a lot of things evolving within the foot and ankle world where the implants are improved, techniques are improved. We've gone to a lot of minimally invasive procedures that have decreased healing time and back to activity shorter than normal.
Yeah.
So even in the last 15 years, there's been a lot of changes that can help people get back to doing the things that they want to do.
Sounds like a lot of options.
There are.
And especially at Common Spirit Health. How would you say that Common Spirit Health stands out?
Well, we can attack it from every angle, right? We have experts in every field who have done extra training in their field of expertise, whether that's shoulders, joints, for myself, foot and ankle surgery. We also have an emphasis on non-operative management with some of our mid-level providers, and so I think we can attack it from every angle with expertise opinions.
Well, and you have a lot of experience, and that's who you'd want to choose, with your health journey. I appreciate you sitting down with me, Doctor.
Appreciate it. Thank you.
Thank you so much. And if you want more information, you can head to the website at the bottom of your screen. Thanks so much.
Ask the Expert, brought to you by Common Spirit Health.